When you are changing an unoccupied bed, you should wear gloves. You wear gloves when you suspect that you may come into contact with human bodily fluids. And for checkoff, I actually want you to wear gloves. Do not just verbalize that you're going to do it, because I need you to get into the habit of actually doing this. Okay? I have my hamper nearby, in which you're going to see different methods in which people change linen. Just get it done. I will do this last. I'm going to make sure I bring the bed to a comfortable working position because I have to protect my back. I am going to roll away. And it is good to know what isolation precaution the patient is on prior to you entering their room so that you know how to protect yourself, so that you wear the appropriate PPE. Now, I will assess the mattress at this point. If it's soiled, I could use the approved hospital or facility wipes. It's usually a purple or orange wipe, or some use bleach as well. I will wipe it down as necessary, and then I will let it air dry. The first thing you're going to use, my fitted sheet. You can choose to do one side at a time, or if you want, you can go ahead and just start the top. What you are making sure is that the linen is as straight as possible. I do not want to see no mountains or valleys. Next, I'm going to put the chucks. The least amount of linen that is on the patient's bed, the better, because of the possibility of skin breakdown, especially if it's a patient who is immobile or has limited mobility. If they're on this and there's a lot of linen underneath them, there's a high risk for a skin breakdown. So if you can, eliminate the use of a chuck, or what you'll see some tech or nurses do, instead will use this. They'll fold it into a particular type of way, or you don't use anything at all.
Why would you need a chuck?
Some facilities for incontinent patients, and instead of using diapers, they want chucks. And again, I'm straightening it out, making sure it's even. And one of the most important things you have to be mindful of is that you make sure your linen never, ever touches the floor. If it does, especially during skills checkup, I will tell you, see you next time. And you want to kind of see if it's even on both sides. Get my top. Straightening it out to make sure there's no creases. Now I am going to tuck the end. And if you have to lift up the mattress, that's fine. Feel free to do so. You have to do what's called the miter. Hospital corners. All right, so you see, I kind of lift this at an angle to create like a tent, and then I bring it over, and you see it has like a diagonal effect, and then I just bring this part here into underneath the mattress, and then I just bring this over. All right, same thing on the other side. Now this is where you'll see some of our CNAs, they like to be a little fancy with fanning the sheet. You can simply either bring it down like so, fold it over one time. Some people you'll see they'll actually fold over like 2 and 3 times. If you want to do that, that is perfectly fine. And that is an unoccupied bed. Now, the only thing is, when I bring the bed back down, I want to make sure my linen does not touch the floor. If I suspect that it's going to touch the floor, and now I adjust, okay? Safety over beauty. Last thing is, of course, the pillow. You go ahead and do this. Or another method you'll see some people do is they roll up the pillowcase. Now, especially for the old school nurses, they will have their particular methods in which they want you to. And then simply apply. Either method is fine. Some people like the extra mild, and then they just tuck this in like so. Okay. So as long as you have a clean pillowcase on, I'm happy. Okay? As long as the pillowcase or any of the linen does not touch the floor, you're safe. Okay? We're cool? All right, that is unoccupied bed.